New COVID cases shot up today to 8,028, and there were 16 more deaths, including a teenager. Some say the big jump in numbers is not particularly surprising because we've just had a long weekend. But the 7-day rolling average is also starting to track up. We're getting about 600 more cases a day at the moment compared to last week. For more on this, I'm joined by epidemiologist Professor Michael Baker now. Michael, we were projected to hit our peak in that third wave in about August or September. Do you think we're finally heading into that third wave now?
Well, kia ora, Yannicka. Look, it's very early to predict a trend, but we certainly have seen a slight rise in cases over the last week. Hospitalisations are still staying in the range of 350 to 400 a day, and unfortunately we're seeing this moving average around 12 deaths a day. So the pandemic is very much gnawing away at us and creating this quite high health burden, but it may be increasing now. I mean, certainly most factors are actually favouring the virus now, and that is that our immunity is waning. We're getting more infectious variants arriving in New Zealand, and also we have relaxed some of our controls. And of course, we're in winter, we're indoors a lot more, and these conditions do favour the virus.
So when do you think we'll know if we're heading into that big peak?
Well, I think we want to watch the pattern for the next few weeks and see what happens, because numbers do go up and down over time. We are seeing this continuing long plateau of cases, but with a slight rise. But we'd need to wait a few weeks to see if this was really going to be a major wave or not.
And you mentioned we've got a few new, more infectious variants causing surges overseas right now. They are starting to turn up in increasing numbers at our border. Is that cause for concern?
Well, it is, and as we know with Omicron, the subvariants that are coming through for a reason, that they have an advantage over the ones they're replacing. And that means that they will be better at escaping our immunity, whether that immunity is from previous infection or from vaccine. And that is just natural selection in operation. But it does have a consequence for us, because it means these new variants will come through, they will be more infectious. Effectively, they will infect more people, we'll get more people getting this infection every day, more people going to hospital, and eventually more people dying as well.
And hospitals are already struggling big time. Half the people in there with respiratory illnesses have the flu, 20% have COVID. What's the one thing we should do right now to help them out a bit?
Well, I think the main thing is to dampen down transmission of these viruses. And that means wearing masks in high-risk indoor environments. And I think particularly schools. I think to get through winter, we need to reintroduce a mask mandate for our schools. Obviously, everyone should be getting their flu vaccine and COVID boosters now. That's really important. And it's also still very important to stay away from school or work if you have symptoms. Even if you don't test positive for COVID-19, you may have influenza or RSV or another virus. So I think it's very important to still have that 7 days away from work and school if you've got respiratory symptoms.
Absolutely. Professor Michael Baker, thanks for your expertise this evening.
Thank you.